Hi, my name is Andrea Roberts, and I'm the Director for Child and Family Health Division at Wellington Dufferin Guelph Public Health, and I'm glad that you've chosen to work with our agency. I'm a nurse. First, I have a Bachelor of Science in Nursing degree from Ottawa University, and then I did a Master's degree in Health Promotion at the University of Manchester in England. I'm responsible for all of the programs and services that operate through the Child and Family Health Division. And so there are over 37 programs in the division, and I oversee both from an operational planning perspective and the budgeting for all of those programs and right through to service delivery. The primary focus of the work in our division is health promotion, and health promotion at a number of levels. We do a lot of community education and awareness, but we also work, especially with young children, on an early identification and early intervention basis. So all of those things together work to support both health prevention of illness and disease, and also to promote better health and functioning for families. So we support positive parenting on a number of levels. We do it individually with families, we do it with individuals, we do it sort of through public messaging in communities, through our education, or through our prenatal education classes, and we also sort of work with community partners to support the message of the importance of positive parenting. So for some concrete examples, nurses answer the phone every day on our kids line, and that's a telephone support line where parents will call with concerns about parenting or growth and development of their children, and they're either given the information and the support that they need on the phone with a nurse, or the nurse would make a referral to some of our other programs and services, either that we offer or that some of our community partners offer. We also are involved with community partners in doing sort of large-scale messages about the importance of positive parenting and the impact that it has on children sort of lifelong. So we work with partners in that way as well. We talk about very early, starting about the adjustment to parenting by discussing sort of positive parenting strategies and attitudes in our prenatal classes. So Healthy Babies, Healthy Children is a 100% provincially funded program, and it's a home visiting program that we offer with, in a partnership with a nurse and also a trained peer family visitor who work with high-risk families to support them in learning new skills and attitudes that will help them to support their children in more positive ways. So at-risk families that we visit are generally families who face additional challenges, and some of those challenges could be low or no income, limited education, poor life experiences either themselves as a child or as a parent earlier with other children, also isolation, mental health problems, or addictions. So the nurse and family visitor work with families from prenatal period up until their youngest child is age 6, and they do regular visits and help families to learn those additional strategies that will make them better parents. So public health has the responsibility for the administration of publicly funded dental programs for children, and so there's 3 that we are responsible for. Our SINOT program is Children in Need of Treatment program, and for that we have registered dental hygienists and assistants who work in the schools to screen children. And if they find, just by looking in children's mouths, that they have significant cavities or sores or that the children are in pain, they alert the parents to that. And they also give parents the information that if they don't have the financial means to pay for that dental treatment, that they can be referred to our SINOT program, where the health unit then picks up the bill for that urgent treatment to be done. And that program is offered for children all the way from birth up to 17 years. And that's our SINOT program. And I think the challenge that we've faced through years of SINOT program is that it's just an urgent treatment. And so we know that unless you do something else, those kids are going to be back in 6 months or next year with another urgent treatment. So a couple of years ago, the ministry put out a program called Healthy Smiles Ontario, and that program is to add the prevention piece onto SINOT. And so with that program, we're able to offer preventative treatment to children under 17 whose families are eligible for that. So the system of care is actually a group of community partners who have come together to look at creating a seamless system of care and sort of a one-door entry for children who've been either suspected or have been identified with having growth and developmental delays. So public health plays a pivotal leadership role in that program. Our Kids Line telephone support line is the one number. So parents, other professionals in the community, early years folks, anybody can call that line, and during that phone call, referrals are made or further assessments are done to determine what services a child might need, and they can range anywhere from diagnosis all the way up to referrals for treatment and intervention. So public health is the number that both the community, family physicians, and parents call for information about that. So We Talk is our preschool speech and language system, and we work with all of the hospitals in Wellington, Dufferin, and Guelph who offer speech therapy in a partnership to create a system. And the role that public health plays is that of assessment. So there's a one line where families or care providers can call to make a referral for a speech assessment, and public health speech pathologists will actually do the assessment for those children and then reassess if that's needed or provide home therapy treatments if that's needed. And they also make referrals then to all of our partners who actually do speech therapy. And it's one waiting list throughout all 3 communities. And so public health is the primary administrative role and assessment role for that program. So what we know from research very clearly is that language ability is very much correlated to academic success and even sort of more general social success in adults. We know that kids who turn up at school not ready to learn, and that may be because of a speech or language delay, we know that they're not going to do well. They're not likely to do well. And the other thing that research clearly shows is that you're able to change the trajectory of academic success if you can intervene before age 3. So we actually start seeing babies as young as 6 months, and because preschool speech and language is offered through this health unit, they work very closely with Healthy Babies, Healthy Children program. So when nurses do that sort of postpartum visit to all moms, if they have a baby who could be at risk for a speech and language delay, for example, their baby was born prematurely or at a very low birth weight, nurses get consent at that visit for speech and language therapists to call the parent at 6 months. So our SLPs would then make that call at 6 months, start talking to the parents about what they should be seeing or hearing, and get a sense of what their baby's doing. And then we'll either call back again in a few months to sort of keep monitoring that, or we'll ask the parent to bring the child in for an assessment. So we know, again, from research very clearly that breast is best. We know that that's exactly the right kind of food that infants need for up to 2 years in their life, including introducing solids after 6 months. So it's important that we create a culture that supports women breastfeeding in public places, in public spaces, and also that we have the understanding of the importance of breastfeeding. And that sort of culturally changes over time in generations, and so we've sort of lost the ability to just pass that information and support down from generation to generation. So we do that through a number of ways by doing broad-based sort of community education, promoting the importance of breastfeeding. And we also do one-to-one support for breastfeeding moms when they start initiating breastfeeding. So we offer regular clinics, and also during that home visit after moms come home with their new babies, their nurses are in their homes and are able to help them get off to a good start with breastfeeding. And we also talk about breastfeeding as early as in prenatal classes, because we want moms to have that information and make that decision before their babies are born. So what it means for public health to be an evidence-based institution is that we very strategically and carefully decide what we're doing, why we're doing it, and where we're putting our resources. We don't do things just because that's what we've always done, or because staff like to do it, or think that it's a nice thing that people like. We make our decisions based on research and best evidence. So we go to the literature to say what strategies have proven to have an impact or to affect a positive outcome. And those are the strategies that we use in our work. So sometimes we create the evidence, and sometimes it's already there, and it's a matter of searching for it and putting it together in a sort of succinct way. So that's a lot of the work that our health analytics team does. Within that sort of group of people, we have data entry clerks, data analysts, health promotion specialists, and 2 epidemiologists. And they work to support the work of the health unit across all the programs and divisions. And it's primarily around that, making sure that we are looking to best evidence when we're making decisions about new programs. They are involved in helping managers evaluate current programs and strategies to make sure that they're still aligned with best evidence. And a big part of their work is also doing population surveillance. So that means having a sense of what are the local issues for Wellington, Dufferin, Guelph Public Health. We know there's provincial priorities, we know that we have provincial direction through the standards, but there's also an expectation that health units would make decisions based on local need. And so our health analytics fill that gap in for the rest of the program managers in the health unit. But even in some of our other work that we do, there's a big crossover with chronic disease prevention. So for example, the Community Health Division focuses on childhood obesity, and yet we know that breastfeeding, for example, is one of the strongest protective factors against childhood obesity. So we're working in tandem. And some of the other areas that we work in is preconception health, for example. Preconception health is really eating well, being physically active, avoiding tobacco and alcohol, all of those sort of healthy living messages that the Community Health Division focuses on. Those are the same messages that we're giving to young women in that preconception age, with the exception of adding folic acid when you're thinking about becoming pregnant. So a lot of the messages cross over, and the target groups cross over as well. I think when we look at healthcare costs and also the prevalence of illness in our population, what we see is that a couple of things. One is that it's predominantly preventable illnesses and disease. And the second thing we see is that illness happens more often and disproportionately among individuals who are disadvantaged for a number of reasons. And so our emphasis has really moved away from, in some ways, blaming an individual to looking at the environment that individuals and families live in and creating environments that will support a healthier choice. In the work in child and family health, we work primarily through our Healthy Babies, Healthy Children program with families who are at that lower end of the social income ladder and struggle every day with social determinants of health. And some of those things can be unstable housing, low or no income, lack of resources, lack of connections, social connections in both their neighborhood and in the community, mental health problems or addictions. And so we work with families on a one-to-one basis to try to help strengthen some of the protective factors that you can build in around, related specifically to the social determinants of health. So we do it on that one-to-one basis. And then one of the pieces of work that I'm particularly proud of that we've done this year is creating a report that looks at the social determinants of health by neighborhood and small geographic locations across Wellington, Dufferin, and Guelph. And what we've learned from that is sort of where the pockets of inequity are. And that information is valuable not only to us, but to our community providers, because we can say to them, in this particular area, here's a problem that's more prevalent than in anywhere else in our area. And also what that information tells them is maybe what we've always done or the usual way of offering services and programs isn't going to work in that area, and you need to think about it differently, and you need to plan specifically around that. You're in it for the long haul. The work that we do in public health, there's no quick payoffs, particularly in child and family health, and especially when you're working with high-risk families. The work is extremely rewarding, and you can make huge impacts, but you're not going to see it every day. Sometimes it takes months, sometimes it takes years, and it's hard to sort of stay engaged and focused on that. But if you can manage to hang in and see it, it offers a lot of reward.